Hello, hello. Hello, hello, friends and family. It's Sunday. This is Sharon Herbert, the Power RN, coming to you from Power Time. And I'm going to tell you, I've dashed in here from the airport. I don't have my sparkly camera and maybe not even my sparkly look, but it was just getting to be 5 o'clock and I didn't want to miss my time with you. So I just want to let you know that yes, I have just returned from Atlanta, Georgia, where I had the pleasure of the company of a number of like minded professional entrepreneurs. Yes, we're entrepreneurs and we are professionals. Professional entrepreneurs that just lit my light on fire. And our coach, Dr. Cheryl Wood, has the gift for sure. She lets me know where I am and where I need to go to sharpen up some of my message. So I am so excited today that, my life is on pure fire. And I want to remind you that our journey is just starting. Our journey is not over. Nurses need each other. We need each other. And I always say that we are family. And you've also heard me say sharing is caring. 2023 is the year for our change. We've gone through and continue to go through being ignored, devalued, stepped on, called the maid, and no one, what? One senator said, oh, she didn't even know that nurses went to college. She was like, nurses don't go to college. People devalue us. We have got to stand up and say who we are and what we do. They won't believe it from anyone except for the news that says, oh, nurses were heroes for COVID, beginning in the pandemic. That was 2020. It's now 2023. Nurses have not gained any power, presence, or purpose in the professional world. Like, oh, we're not doctors. Oh, well, there are nurse practitioners who now have doctoral degrees. Now, that's a challenge. That does not mean every doctor has to perform a surgical procedure. Doctors and doctors of nursing practice have to be educated and complete years of education and as well be licensed to practice in whatever setting they choose. What is the problem? Now, this big spiel about, well, so and so, that nurse practitioner called herself doctor. And one nurse had to pay some $19,000 fine because she documented doctor. Well, she is a doctor of nursing practice. So we have got to stand up for ourselves. We've been going through years of stressors, staffing shortages, low pay, promotions, not so much promotions because, you need to just stay where you are because if you're promoted, and then who's going to take your place on the med-surg floor? And then your unit, ooh, they might overdo their budget if they give more promotions. And what will the organization's leadership say about who and where and what and why nurses are getting promotions? We have got to make a change in 2023. Change is on you. You are the governor of your own professional life. You deserve what you want. Whatever you want, if you want to be the unit leader, you should be so. Following whatever the agenda is in a spirit of excellence to make those moves. Whatever you want to do, whatever you want to be, you should be it. You should do it. And my new mantra that you really haven't heard is think. Think. Think about what? Think. Let's think in this year. Let's not just let people do whatever they want to do to us, say whatever they want to say, and we just take it. We get beat up in the hospitals and workplaces, accosted and assaulted by patients. People walk into hospitals with guns. Well, when you're working in your organization, whether it's a hospital, public health, community center, whatever it is, you're there to do your good job in healthcare practice. You're not looking to fend off evildoers. So we've got to get this straight. You need to let people know who you are and what you do so that they can understand why it is that they should be your friend, and you can be their friend in helping them develop and undergo the plan of care that you have helped the physician create. That's what kind of relationships you can grow if you speak out loud. You can't ignore your patients. You can't ignore your colleagues. We're working together in a system to make everyone better. And it can't work all the time, but that doesn't mean that we're not going to be doing the work and trying and engaging people to understand as we speak to them about what's going on either in their body or with one of their loved ones, what things we can seek to make change a positive for the time that they are looking to feel better and to be helped by someone in the healthcare system. How many people have gone to the ER because after 3 years of COVID and lockdowns and changes in staffing and statuses, many health providers have closed their doors. Your doctor might not even be practicing anymore. They might be doing something different or nothing at all. And they're not available for you. And this is so much of the good news. Nurse practitioners and doctors of nursing practices have taken strides to provide information related to health care for lots of communities that now are seeking care because their one practitioner, the physician in their neighborhood, has left and they have nothing. Now, we have got to share all of these stories. And as you know, the power to change is in your hands. Now, I told you my story. I wanted to be a nurse since 5 years old. And I have made that leap. And in between, I've done so many things. I love my 25 years of service in neonatal ICU. Now, if you haven't heard me say that, you will see me smile as I think about my preemies, but especially my babies with tracheostomies. I think in the years that I was in that NICU, I must have taken care of every single baby with a tracheostomy, and I love them so much. And it just brings joy to my heart to work with parents to help them be able to safely take care of their babies at home. Just because you have a tracheostomy doesn't mean you have to go to a rehab center. We can do all these things. Let people know who we are. And that is one thing that really I struggle with when the patients, the customers, the clients, members of your healthcare team don't even know what nurses do. So, how can they share the good news about who we are and what we do if you won't even do it yourself? You won't. I have created an anthology project, and it is Not All Angels Have Wings. And that really is the best of the message. It's you. Let people know it's you. Then you don't have to go back later trying to explain why you should be promoted, why you should get a raise, why you should be treated like a person. You can stand on your own 2 feet. And you can let people know the goodness of your career path and your profession. Share it with the nursing students. They really have no idea what's going to happen in the future when they get their license and they get their job. They are scared. Let them know that they can make it. They can survive, and you're here to help them. You can't help them if you don't tell them what they can do and that you will help them take the steps to success as a nurse. Tell them. Don't put roadblocks in their way, because in 2021, there was a good number of nurses, yes, many thousands, many, that passed their boards and started practice in a facility, most often a hospital, but it could be somewhere else. But the world of healthcare was so upside down, COVID pandemic, people struggling with home care, health insurance, getting their medications, that those young nurses just were kind of left to figure out what they should do. And you know what happened? It was not a good year for nursing. And by 2022, lots of those young nurses have left nursing. They were stuck in a place with so many disruptions. Disruptions could be staffing. Disruptions can be orientation. Disruptions can be, how do you chart? Disruptions can be, well, I don't know what to say to my patients, and should I be talking to their families about their last days and how COVID is affecting their bodies? Well, I don't really know, because I didn't ever get a chance to do that. And, we barely had clinical in that year that was from 20 to 21 when I graduated. Some people didn't even have clinical sites. We've got to help each other. Tell the stories of what you need when you're asking for a thing. If you're asking for, your patient needs a discharge plan. Your patient needs a social worker. Your patient needs a challenge with how to complete their medication regimen. How will they do that at home when the nurses are not knowledgeable and experienced in how to care for these patients who have been discharged to the nursing home or to home where they don't have assistance, not professional assistance. The choice to fix any and all of this is yours. You know the answers. You know the answers. Don't keep that to yourself. Your colleagues are your family. We do this together. Nursing is not a one-man show. Nursing is a team. Nursing is a family. And I want to see you all be better at communicating. We've got to talk to each other. We've got to share solutions with our leaders. They are responsible to report to the next level. But if you don't tell them what's going on, what will they report? What can they fix? What can they help you solve if you don't tell them? We have millions of nurses on the face of this earth. And even in Facebook, LinkedIn, Twitter, we have millions of nurses. Tell your story of your journey. It doesn't always have to be bad. If it was that you created a solution for the staffing challenge on your unit, if you created a team set up in the nursing home, who does what? Who does what best and better? You know these things. Help folks get through. And you know, as I say, sharing is caring. We can't fix this if you keep the solutions under your hat. We've got to do this. We can overcome anything, and we have for hundreds of years. We can do it, but we can't do it one person alone and one person at a time. Share your stories of your successes, your challenges, your rewards. Share your stories in the Nurse Anthology Project. You can call it a book if you want to. People need to know how things work well as we solve the problems in our profession. No one else is going to know what works for you and what doesn't. No one in the C-suite has been in your space and place taking care of heavier workloads and more challenging critically ill patients. Now, they may have heard something and they may have seen something on the news, but I bet it's not you on the news because you're not telling your story. I'm going to tell you all, as long as I have been a nurse, more than 30 years, I wish that I could be in the place and space to make a difference in each of your lives, face to face. But today, we are on social media, but we've got to meet each other and love each other back to health in nursing, back to health. And for me, as I worked to help engender new life and new love into home health care in the last, maybe I think 10 years or so, after my 25 years as a NICU nurse, it is still challenging and there is work to be done. But you know, we're not afraid of work. And for me, I worked to help organizations get their accreditation and complete their policies and procedures. And you know, you've heard of Joint Commission. Yes, you have. Well, I don't say one good thing or one bad thing about either. But I will say this, that I enjoyed years of working with home health organizations as an entrepreneur, a healthcare consultant, to complete the work that needed to be done for the organization to be able to have nurses to employ and sites for nurses to go to help patients in their home. And in the midst of that and all the things I was doing, never too much to be shared. Yes, I did way too much, and I didn't take care of myself. And I had a stroke. Now, yes, I had a stroke, and I'm going to tell you, it was the darkest days of my life because I love nursing so much. I want you all to be happy and confident in your workplace and space, and cap that with safety. But we've got to do something about our own situation. I can no longer practice as an RN because of my injury, but I still have love for nursing. I still have care. I want you all to be able to have those things as well, but you've got to reach for it. It's in you. You've got to have and engage your own power to bust open this cage that you've been shut down in. You've been shut down in the cage of somebody tells you what you have to do every day. You don't get to think, you don't get to be, and you don't get to do the things that you've been educated and experienced to do. We've got to do better. And I want to create this book. This book will save lives. This book will save lives. Lives of your colleagues, lives of your friends, lives of your family and loved ones. What nurses in your organization have suffered with mental health challenges? That's a disruption in your life. What nurses have suffered physical challenges? That's a disruption in your life. These were caused as a part of your COVID experience. That's the thing that I'm asking you to share. Your COVID experience. It is not a joke, and it is not something you should be ashamed of. The message that you share and your story can help another nurse feel better, understand that it's not okay to keep your pain inside. That's a disruption for your life and your family. Tell your story. Join me with this anthology project. Not all nurses have wings. I'm going to make it nurses. Yeah, you got wings, but we'll just stay on the track. Not all angels have wings. And you all, men and women, are here for a purpose. Let the world see your purpose. Tell them your story. Don't let the world, the newscasters, and even physicians or radiologists tell your story. It's yours, and you know how much it took for you to finish that education and get your licensure and keep growing, and growing. So you got a master's degree, and now you got a doctoral degree, and now you've become a faculty, and that's a way that you're sharing your life, nurse life experience with the world. Join me. Sharon H. at PowerInNursing.com is my email, and you're going to see me tomorrow, the next day, the next day, the next day. We're going to start on the drafting of the stories and the writing of the stories with Dorothy Wilson a master publisher. She's going to help us get all the I's dotted and the T's crossed. Because this isn't for me, and it's not even for you. It's for the world. The world. You know, the healthcare system cannot function with us. And if we're not there because we left, we ran away, or we stuck our head in the sand and decided we're not going to be engaged in healthcare anymore, there's a big loss in the world. So join me. I'll be sending more invitations, and Dorothy Wilson and her team have sent out a message as well. This is a message for you to save your colleagues and save the world, along with your friends and family. So this is Sharon Herbert, the Power RN, coming to you from Power Time. DM, email, text, whatever you have to do. We need you to tell your stories. Nursing is always, every year, it's a happy award. We are the best. But no one knows what we do. How can that be? You're the best what? Smiler? You're the best what? Bed changer? You're the best what? You solve people's problems. That's what you do. Do they know that? Is that what they're celebrating for you? I bet you not. Tell them who you are. Share when you meet your new clients who you are and what you will do for them, along with the collaboration of the team and the patient's agreement. That's what we do. We're not here just to look out the window and ban, visitors from coming into the building. That's not what we do. So I love you guys. And yes, I have been infused at my mastermind in Atlanta. And yes, I've been quiet. But quiet no more. I love you guys, and I want you to be the best you ever. If you want to be a nurse practitioner and you're stuck in the med-surg unit because you don't think it's okay to let anyone know that you have aspirations and that you want to grow, let's talk. That's my next line. Who wants to grow from Bachelor of Science in Nursing, BSN, to beyond? There are so many opportunities for you to grow, learn, and help people. That's what we do. That's what we do. So hit me up. I'm coming back tomorrow. I'll have all my stuff together because it's still in my suitcase. Thank you, thank you, thank you. And you'll hear and see from Dorothy Wilson and Associates. Don't just scroll by. I don't know when you all are looking, or many times when you have questions. You should have lots of questions about where you are right now in nursing. What's your plan? And remember, this is a safe place. We don't tell your business. So don't say, well, I didn't do it because I didn't want Sharon to tell anybody. No, we don't do that. We're looking for the best for you as you continue to give, care, and serve. So bye-bye now. I will see you tomorrow. Have a great, great rest of your Sunday. And thanks for joining me. Bye-bye now.